Joining me today is Dr. Kevin Kaplan, Jacksonville Orthopedic Institute and team physicians for the Jacksonville Jaguars. Thanks for being here.
It's good to be here again.
So, and I guess, these guys are stretching and doing all kinds of things, I guess, just to help them prevent injuries as well.
We have a great strength and conditioning program. That's part and parcel to our preseason program and trying to prevent these things. But as you said, it's a contact sport. There are some times where someone's going to get hit a certain way, and no matter how strong and how big you are, if your knee goes in an abnormal direction and your foot's planted, you can have an injury. Look what happened to Dalvin Cook a week ago. He's
terrible.
Strong, healthy, big guy, but he cut the wrong way and his foot got stuck and unfortunately had an ACL tear.
As far as the surface goes, do you see more of that on turf or grass, or is there a difference?
We do see a little bit more of an injury, and there have been studies about that on turf as opposed to a natural grass field. With those turf fields, sometimes the cleats get stuck into the ground, and you can then that can cause your knee to pivot out and have a pretty significant injury.
There's not many grass fields left, are there?
Not a lot of them. You look at a lot of teams we play we played on turf last week.
Right.
Well, it's just easier to take care of, I suppose. So.
Yeah, I guess. Yeah, I don't know. There's something about an outdoor field with some grass. Me just thinking about football. Kind of the smell of football.
I agree, and I like it medically speaking. I like that better too.
Yeah. So I guess you're still enjoying it. That's good. You're just gonna keep on taking care of the Jags.
As long as I get the opportunity, and they keep giving me the opportunity, I enjoy it. It's part of my regular routine, and I love the office. I love surgery, the taking care of the patients here. That's just a different dimension that not a lot of people get to do, and so having the opportunity is amazing. It's been
you have to have a passion for it. In theory, most of us have Sunday off for sure. Most Saturday. For 6 months, you're pretty much 7 days a week.
That's correct. You got to love it, and I do. I just hope we keep improving as we are going along here.
Well, so I got to ask you this, and I'll get you out of here just out of curiosity. Your schedule. Give me a typical start when you get started in the morning, whether you're working out, and when you end.
Well, I usually try to work out. I have two little kids. I have a boy, Dylan, and Kylie's my daughter. So obviously I can't work out in the afternoon because I want to go see them at the end of the day. So I'll work out, 5:30 in the morning, get a nice workout in, and then depending on the schedule with the Jaguars, do that. Come here, either operate or see patients. And usually I'm getting out of the office or surgery 5:36, and then heading home and playing with my kids and saying hi to my wife, eating dinner, and then making my phone calls to the agents and the coaches, and then doing it all over again.
Starting all over. Well, it's busy. I know you enjoy it, and I appreciate you talking with us today, and I'm looking forward to a really big season.
Me as well, and thanks for having me again. I appreciate it.